Conditions such as osteoarthritis and osteoporosis are often seen as a natural part of the ageing process, meaning many people are suffering in silence, unaware that help could be available. Researchers at Keele University are collaborating closely with patients and the NHS to test treatments, improve care and provide better outcomes.
Hello, can I help you?
I was looking for some information on osteoarthritis.
Oh, well, let's have a look, see what we can find.
If you've been diagnosed with osteoarthritis, you're bound to have questions.
Would
Yes,
that help?
that's lovely, yeah.
But where do you find straightforward answers?
So thanks everyone for coming to the meeting today.
Here at Keele University, patients, researchers and healthcare professionals are working as one multidisciplinary team to provide straightforward answers to straightforward questions.
What is osteoarthritis? What causes it?
This animation and accompanying leaflet have been developed in conjunction with patients. The resources contain a new explanation about osteoarthritis called Osteoarthritis and You, There Are Things We Can Do.
Nice to watch, friendly and easy to understand.
The resources are evidence-based, using results from Keele's research study PEP-OA. The research found out what people with osteoarthritis want and need to know to help self-manage their condition. They're also freely available for the public and NHS to download by scanning this QR code and following the link to the keele.health website. John's been involved since the start of the project and even has a starring role in the animation.
At the outset, we decided that the language that most people associate with osteoarthritis is quite tricky to understand. How do we go about making it easy for the public to understand more readily what's going on? So the idea was to gather together all the types of phrases that people associated with osteoarthritis and then have a survey comparing what we thought was a better phraseology to what was already in the public domain.
The patient involvement group have helped us pull it all together. So they've helped us with the storyboard, they've helped us to kind of work out what the images should look like, the tone of the animation. These resources help healthcare professionals to deliver recommended care and clinical guidelines because we know that the provision of good quality information is core treatment for osteoarthritis.
As well as improving information, Keele University is also involved in clinical trials to test and assess different forms of treatment.
We've recently done a trial looking at whether steroid injections are helpful for people with hip osteoarthritis. And it was an important trial to do because at the moment people with hip osteoarthritis are not always offered a steroid injection. And that's not surprising because before our trial there wasn't really any evidence to know whether steroid injections were helpful for people with hip osteoarthritis or not. And the trial showed that people who'd had a steroid injection into their hip joint benefited the most. So that was really important because that's generated new knowledge.
Hello, is it Michelle?
New technology developed at Keele is also helping the NHS tailor consultations for osteoporosis patients.
What we'll do is we're actually going to use the computer just to aid us in this consultation today, if that's all right with you.
Yeah, that's fine.
Improved fracture prevention, or IFRAP, prompts clinicians to ask certain questions, as well as providing access to a range of visual aids. This computerised decision support tool enables clinicians to communicate more effectively with patients, helping to demystify the condition and discuss next steps following diagnosis.
It helps people to talk through their individual risk of fracture and also what treatment options are available. And this IFRAP study contains the decision tool itself, a training package for healthcare professionals and also resources that GPs and patients can use.
Keele also has a dedicated Impact Accelerator unit. This specialist team helps NHS healthcare professionals use the results from research to treat and manage patients in a way that's best for everyone. From consulting room to living room, a range of resources helping patients get answers to their questions about these common conditions.